You might look at chapter 2, which is fluid, electrolyte, and acid-base imbalances, and say, holy cow, there's a ton of information in this chapter. And there is. But I will help you navigate it and narrow it down to what you really need to know. And really, we're going to talk about the basics, and then we're going to talk about the effects on rehab. I have a few case studies that we're going to look at just to kind of get an idea of what a patient with one of these imbalances is going to look like. And I'm going to split it up really into three sections: fluid, electrolyte, and acid base. But I'm going to split that even further in the fluid imbalances. I'm going to split down a little more just so we don't have horribly long lectures. So give you a little respite from listening to me talk. So here we go, fluid imbalances. Learning objectives for the first part, which will be in this section, will be explain the movements of water between body compartments that results in edema. So basically the causes and effects of edema. And then the dehydration section will be the causes and effects of dehydration. So edema and dehydration are sort of on opposite ends of the fluid spectrum. Edema is too much fluid and dehydration is not enough. So the major component of the body is water. Even though we seem like we're solid, a really large percentage of the makeup of our body is water, and water is essential to homeostasis. So all of the processes that go on our body to maintain homeostasis use water as the medium. So it is the medium for metabolic reactions. So any reactions that go on cellular metabolism or any other kind of reactions happen in water. It's the transportation system for the body. So the fluid in blood and the fluid in the lymph system. And we talk about white blood cells going from one place to another. Well, how do they get there? They get there via water. So it all gets there. Water also facilitates movement of body parts. So the fluid in the pericardial sac that allows the heart to beat, the fluid in the synovial capsules, which allow the joints to move. So fluid is very important for a lot of these different things. And in this diagram, you see a lot of our organ systems or organs are made largely of water. So a lot. So we're mostly water. Interesting, right? Approximately 60% of an adult's body weight is water. Obviously varies from adult to adult. About 70% of an infant's body weight is water. Females have a higher percentage of fatty tissue, darn it, on average, and therefore lower water content. Older adults and obese persons have a lower proportion of water as well. So when people have a lower proportion of water, we say they have less fluid reserve, and individuals with less fluid reserve are more likely to be adversely affected with any fluid or electrolyte imbalance. And your fluid and electrolyte and acid-base balance are all very interconnected, which is why they're all in the same chapter, and we'll talk about it. So this is the table 2.1. The green and white tables in the book are such a good resource, and in fact, you can think of them as like little study cards. It's information in a nutshell, and that's the depth of the information that you need to know. So it shows the approximate percentage of body weight, a male, female, and an infant. So imagine they mean adult male, adult female, and an infant. And so you can see that adult females have a little bit less percentage of water. And the volume, I think it's interesting, 43 liters of water. That's crazy that you could even get that into a body. And it's split up between these different compartments. So we'll look at the different compartments. So the fluid compartments, the intracellular fluid compartment, or the ICF, it's the fluid inside the cells. So that's where our cellular reactions are going on. And there's the extracellular fluid compartment. It's anything outside the cells. So that includes the intravascular fluid, so the fluid inside the vascular system and the lymphatic system. the interstitial fluid, which is around the cells, outside the cells, the cerebrospinal fluid, which cushions and nourishes the brain and spinal cord, and the transcellular fluids. So transcellular fluids are any fluids that are going from one cell to another. So various secretions, hormone secretions, endocrine gland secretions. The pericardial cavity, that is a transcellular fluid, the synovial cavities. So lots of different compartments in the extracellular compartment, and then the intracellular compartment is inside the cells. So we should have a pretty equal amount of intake and output of water. So the amount of water entering the body should equal the amount of water leaving the body to keep that balance. So most of our fluid intake is from the ingestion of solid foods or fluids. And most of our fluid loss is through urine and feces, with some loss from perspiration and exhaled air. So another one of my favorite little green and white tables. You can see that liquid and solid food, you get a lot of fluid from both. So it's not just what you drink, it's what you eat as well. We get some amount of water intake from cellular metabolism, because if you recall, cellular metabolism is hydrocarbons burning in oxygen, creating water and carbon dioxide as byproducts. So the water, that goes to one of our sources of water, 300 milliliters from cellular metabolism. And the carbon dioxide comes in again on the acid-base balance, so we'll talk about that. So about 2,500 milliliters or 2.5 liters for intake, and then output mostly through urine and feces. Those are the water losses that we're aware of. And then insensible losses from the lungs and the skin. If you're in a really dry environment, if you're in the desert in Arizona or in Colorado, you might have to drink more water because you might be losing more from your exhale and from your skin because of that dry environment. But our sources and losses should be pretty equal, so we stay in homeostasis, right? We stay equal. One of the mechanisms that our body has for keeping that balance of water and electrolytes is our thirst mechanism. So we have osmoreceptors in our hypothalamus that are basically sampling our blood, and they say, oh, blood's kind of thick, let's get some water in there, and they trigger thirst. That's handy. If you are thirsty, if you're already thirsty, then you're probably a little bit dehydrated. So regular water intake is a good thing. Antidiuretic hormone controls the reabsorption of water from the kidney tubules. If you don't have enough antidiuretic hormone, that's called diabetes insipidus, and the water isn't reabsorbed, so you lose a lot of water. Aldosterone is another hormone that controls the reabsorption of sodium and water. The heart produces, or the myocardial cells produce natriuretic peptides, 2 different types, that regulate fluid sodium and potassium levels. And we will find, as we talk more about these different systems, that the heart and the kidneys work together a lot on regulating blood pressure, regulating fluid, regulating sodium and potassium levels. You can't live without either your heart or your kidneys. So, and they're very interdependent. So fluid is going to circulate throughout the body via filtration and osmosis. And filtration and osmosis are dependent on membrane permeability. So the cell membrane permeability and the permeability of the capillaries, so the water can get in and out of the intravascular compartment. Water moves between compartments either by hydrostatic pressure, which is a pushing force, or osmotic pressure, which is a pulling force. So hydrostatic pressure is largely due to blood pressure, fluid pressure, and the hydrostatic pressure at the arterial end of the capillary beds is a little bit higher than the interstitial space, and so water gets pushed out through in the capillaries. On the venous end, it's a little bit lower, and so water gets pulled in. So you can kind of think of that as the nutrients and oxygen going into the cells and the waste products and excess fluid coming out of the cells. if you want to think of it that way, because really that's what the capillary beds are doing. Osmotic pressure is largely controlled by dissolved proteins and electrolytes in the blood and in the interstitial space, just in the body fluids. And it uses a chemical gradient to control the flow of water. So water is going to go where there are more dissolved solids. And so there are usually more dissolved solids inside the lymphatic vessels. And so water goes into, is taken up by the lymphatic vessels and returned to the circulatory system. So hydrostatic pressure, pushing pressure, osmotic pressure, pulling pressure. When we start talking about edema, especially when we're talking about lymphedema and treatments for edema, which we'll talk about in the fall, we will say, what is this going to affect hydrostatic pressure, or is this going to affect osmotic pressure? And what effect is that going to have on the edema? So fluid excess is edema. And the actual definition of edema is an excessive amount of fluid in the interstitial compartment. So not in the cells, not in the intravascular compartment, but in the interstitial compartment. And that's what you're going to see as swelling or enlargement of the tissue. That's the effect of the edema. Edema may be localized, like if somebody comes up and punches you in the arm, you might have a bruise and a little bit of swelling. That's localized edema. And you know to avoid that person in the future. It might be throughout the body. So it might be in an organ system or a certain area of the body or a very large area of the body. Edema that is throughout the body may, or even localized, may impair tissue perfusion, meaning you can't get oxygen and other nutrients to the cells in that area. It's impeded by the edema, and so it might cause cell damage. Edema may trap drugs in the interstitial fluid. So you can sort of think of edema as being like a traffic jam. The highway is not moving, the transportation system is not moving. So things stay in one place longer, and trapping drugs in the interstitial fluid, then they can't get cycled out through the body and eliminated through the kidneys or through the liver like they should be. That could be a serious situation. So edema, there are four main causes of edema, and I would like you to know these. It can be caused by increased capillary hydrostatic pressure. So higher blood pressure or increased blood volume can cause edema because it forces the increased fluid out of the capillaries into the tissue. So you have that higher blood volume and higher blood pressure, and it pushes more fluid out into the interstitial space. Usually increased capillary hydrostatic pressure is the cause of pulmonary edema. And that's edema in your lungs. That's never good because then you don't have enough space for oxygen exchange. Loss of plasma proteins, particularly albumin, can cause edema because it results in decreased plasma osmotic pressure. So it decreases the pulling force. So either to cause edema, you either have to increase the pushing force, that's the increased capillary hydrostatic pressure, or you have to decrease the pulling force so the fluid stays out there in the interstitial space. So loss of plasma proteins will cause that. An obstruction of the lymphatic circulation can cause localized edema because excessive fluid and protein aren't returned to the general circulation. So that's a kind of a traffic jam situation too. I have heard lymphedema or lymph obstructions as being called analogous to like a storm sewer backing up. The fluid just builds up because there's no place for it to go, if that makes sense. So increased capillary permeability usually causes localized edema, and increased capillary permeability can result from an inflammatory or infection response. It can result from histamines or other chemical mediators, which increase capillary permeability, and we'll talk about that coming up in chapter 5. Also, some bacterial toxins or large burn wounds can result in widespread edema because they cause that backup effect. They cause that traffic jam effect. Large burn wounds, usually there's no place for the fluid to go because scarring from burn wounds can impair vessels. And so there's no place for the fluid to go, and it results in widespread edema. So the main effect of edema is swelling, or the main visible effect. It can be in a local area or it can be systemic. Usually the skin is pale or grayish or red in color. Pitting edema is where you have that excess interstitial fluid, and when you apply pressure with your finger, it makes a little pit, and that depression remains when the finger is removed. And so normally, if you press down on your skin, it'll spring back up. But if you have excess edema, you press down and it leaves a fingerprint. So there's pitting and non-pitting edema. But you would, if you observed pitting edema, you would describe that in your documentation. And there's a measurement method for pitting edema, how much the depression is and how long it stays and that sort of thing. But we're not going to talk about that right now. Edema can cause an increase in body weight because there's more fluid, and fluid weighs something, so it can cause an increase in body weight. That is one of the ways that people with heart failure can monitor their fluid balance, is by weighing themselves. So that's a good way to do it. Another effect of edema is functional impairment. So if you had a lot of swelling in a joint, it could restrict the range of movement in that joint, or range of motion. So a lot of times after surgery, after knee surgery or any kind of orthopedic surgery, you'll have localized edema in that area, and the joint range of motion is restricted because of the fluid in there. It can also cause reduced vital capacity. If there's swelling in the lungs, there's no place for them to move. And so that can reduce your vital capacity. And it can cause impaired diastole. Diastole is the relaxation phase of the heart. So systole is when the heart is contracting. Diastole is when it's relaxing. So if there's excess fluid pressure, the heart can't expand and relax and let in fresh blood. Edema can cause pain because it exerts pressure on local sensory nerves. If you have cerebral edema, which is swelling in the brain, pretty serious, it can cause headache. And if you have swelling in organ capsules, the stretching of the capsule, the kidney or liver, can cause pain as well. Edema can also cause impaired arterial circulation, which can lead to tissue breakdown through ischemia, because if you have impaired arterial circulation, you're not getting oxygen to the area. So from, relatively harmless to pretty serious effects of edema. You could also have dental complications. If you have gum edema and you wear dentures, they might not fit. So that could impair your daily living. When you have the skin in an edematous area is more susceptible to tissue breakdown from pressure. So edema can have widespread effects and serious complications.